It's about 6:05. Kaylin, feel free to take it away.
All right. Are you putting the slides up? They've disappeared. Well, I can go ahead and welcome us all. It's so good to spend this evening with everyone. Thank you so much for joining. I know everyone is coming off of, I'm sure, busy and hectic days. So we really appreciate everyone taking the time to join us this evening. And we're really thrilled to have you and all of our presenters to discuss what's happening with Medicaid in North Carolina, and how we're moving forward with managed care and what that really means for you and what's available to you through all of the plans that will be in charge of providing care. So, jumping in, I will give just a very brief, quick and dirty overview of Medicaid transformation and some kind of really important key points to that before I kick it over to our plan representatives that we're so thrilled to have with us, who will be giving kind of brief presentations of what they're offering, and other important items that they want to flag for y'all. Then we will have a member of the enrollment broker team who is really, the enrollment brokers, of course, are here to help folks find the right plan for them. And then last but certainly not least, we have a representative from the Ombudsman program. And then we will close out with some time for questions. If you have questions as presentations are happening, please feel free to drop them in the chat and we'll make sure to flag them for presenters. And with that, I will go through, again, kind of a very high level overview of this transformation. So on July 1st, 2021, NC Medicaid is moving from fee-for-service, where the state really, or NC Medicaid Direct is probably what you know it as. The state was paying providers directly to provide healthcare services. And now we're transitioning to what we call managed care, where health plans that we have here to talk to us today are really administering your care. So these prepaid health plans, we might call them PHPs to save a little time and a couple of extra breaths in those words, are really made up of a group of doctors and hospitals and other service providers that work together in that plan to get you the care that you need. This care includes physical health, behavioral health care, and of course, medications. But as y'all will hear from this evening's guests, the plans can add additional services and incentives to really help make sure that all enrollees are able to get healthy and stay healthy. So very quickly, some kind of key points on Medicaid transformation. We are currently in what is called the open enrollment period, where you can select a plan that's available. And the enrollment broker, our friend Carter, will talk a little bit more about that later. The current open enrollment period ends on May 14th. So that's really important. And remember, managed care goes live July 1st. So you will still have to go through the same process to enroll in Medicaid through your local DSS office. They will help make sure that you are eligible and get you enrolled. You must be enrolled in Medicaid before you can enroll in a plan. Most people who are currently in NC Medicaid Direct will have to enroll in a plan by July 1st, or they will be auto-enrolled, or excuse me, by May 14th, when the open enrollment period ends, or they will be auto-enrolled into a plan based on some criteria like their geography, the primary care provider they currently have, and some other considerations. You do not have to enroll in a plan just yet if you are on any of the innovations waivers, if you are a part of the traumatic brain injury waiver, on Cap C or Cap DA. And if you qualify as a member of the Eastern Band of Cherokee Indians, then you can choose the either tribal option plan or continue to get services for from any NC Medicaid or NC Health Choice provider. Sorry, end of the day, we're all doing great. So without further ado, I will kick it over to our health plans. We are starting this evening with a representative from AmeriHealth Caritas of North Carolina, Lindsay Lawden. We're so happy that you're with us. Please feel free to take it away, Lindsay.
Thank you so much, Kaylin. I'm going to try to share my camera again. I'm having some technical difficulties with my camera, it appears, this evening, so I apologize. What I'll do is I'll just move forward and we'll have our PowerPoint and that'll be fine. So again, my name is Lindsay Lawden. I am a community educator for AmeriHealth Caritas and I am located in Asheville. I serve all of Region 1. And here I'm getting to the slides, I'm sorry. Let's see, that's the one. We're going to go to the top. Slowly but surely. Can everybody see my screen? Yes, okay, great. So as Kaylin mentioned, Medicaid managed care is, we're currently in open enrollment that began on March 15th. And so I'm going to show you a PowerPoint that gives you a little bit of background about AmeriHealth Caritas and about Medicaid managed care. So AmeriHealth Caritas is a company that has been around since 1984. We were founded by a group of nuns, the Sisters of Mercy in Philadelphia, who saw a need to provide primary and preventive care to the underserved. And as you can see, we're currently in 13 states. We're about to have another state, I know, that's going to come on, and we'll have more than 4 million members and a little more than 7,000 associates, which is what we have now. But our vision at AmeriHealth Caritas is to really focus on the social determinants of health and address the social determinants of health as a way to approach wellness from a holistic standpoint. So a little bit about Medicaid. Everyone here is probably pretty familiar with what Medicaid is, but Medicaid is a program to provide health care coverage for low-income families and individuals, in case you didn't know. It is jointly funded by the state and the federal government. And in North Carolina, we have the program administered by the NC DHHS, which is the Department of Health and Human Services. And so managed care, operating under Medicaid with Medicaid, is a program in which the states contract with PHPs, which again, PHP is prepaid health plans, to provide the Medicaid services and administer services to Medicaid beneficiaries. The goal of Medicaid managed care is to reduce overall health costs and promote better health outcomes. And the way that we do that, again, is to ensure that the top priority is preventive care and establishing a strong relationship with a primary care provider. Some of the Medicaid mandatory benefits that everyone will get, regardless of what state they're in, are seen on this list here. Things such as inpatient hospital services, going on down home health services, rural health clinic services, tobacco cessation counseling, as you see for pregnant women at the bottom. There's a long list here. And so everyone gets these benefits, and these are things that we all would expect to be provided. But in North Carolina, we have some additional services that are available. And as you can see, we have dental services, vision and hearing, medical equipment services, mental and behavioral health, podiatry, prescription services, prosthetic services, and transportation to and from hospital and provider appointments. So we have a little bit extra here in North Carolina, which is really great for our Medicaid beneficiaries. So what else do we do? We also have value-added benefits. And so some of the value-added benefits, this is not a complete list, but some that we have at AmeriHealth Caritas are, as you can see, the Boys and Girls Club membership. This will be with contracted clubs and for qualifying members. We're working really diligently to get all Boys and Girls Clubs across the state contracted. That's an ongoing process. We also will be providing vouchers for GED test prep for our members that would like to get their GED, and there will be the SafeLink wireless cell phone, which will have prepaid minutes every month, and WW, which is formerly Weight Watchers. And that will be available for qualifying members as well. I think that's going to be a 6-month membership, what we're going to do. So Medicaid Managed Care in North Carolina actually was really, the ball started getting rolling in 2015. So it's been a few years. We've had some hurdles getting through some budget deadlock and things with our General Assembly. But in 2019, we did get the wonderful addition of 5 PHP contracts to come in Region 1, there'll be 4 with the tribal option as well. And so AmeriHealth Caritas is one of those. And in 2020, we got our start date. So on July 1st, 2021, we will go live, and everyone will hopefully be seamlessly lined up and have their ideal choice for their PHP. So this is what the state looks like and what the breakdown of the different regions and how it's going to work. I in Asheville am in Region 1. As you can see, there are 6 different regions. And so each region will all receive the same services, except in a couple of the regions, we will not have one of the providers. We're going to have a tribal option here in Region 1, but we will not have Carolina Complete. And one of the really cool things that AmeriHealth Caritas will be doing in each region is that we will have wellness centers. Our wellness center in Asheville is going to be downtown on the bus route. And in our wellness center, we will provide things like health education and health screenings. We will have our health educators, our care managers, and our care crew volunteers, which care crew is a volunteer program that we all engage in. All associates at AmeriHealth volunteer within the community. But some of the things that we're also going to do in our wellness centers is we're going to have things like Zumba classes, self-defense classes. We will have discussions about social justice topics. We will have financial planning services available. We will do tax preparation. We're going to do cooking demonstrations. We're going to do all kinds of really cool things, mom and baby classes, book clubs. So each region will have a wellness center that will be a brick and mortar location where our members can come and engage in important and meaningful community events. So that's all that I have. Are there any questions?
It doesn't look like there are quite yet. Please feel free to, yes, this, I have a question of whether the slides will be shared. We will be recording this, so we will be recording the this presentation and sending that around, and I will confirm with all of our presenters whether we can share slide decks afterwards. So we will have that answer hopefully shortly. But please feel free to add your questions into the chat box. And so now I am...
It looks like we have one question in the chat from Tamara. And the question is, will you have wellness centers and multiple sites within each region?
At this time, we are going to have one brick and mortar wellness center in each region, and we will have a mobile unit. Hopefully, we're going to have one. We're looking to partner with a mobile unit that is already underway in Region 1, but we will also ideally have our own that will go across the state. As far as brick and mortar buildings, we will only have one, however, in each region.
Thank you so much.
Thank you.
All right. So now to keep us moving right along, we are going to turn it over to Christy Kent from Blue Cross Blue Shield of North Carolina. Thank you so much for being with us tonight, Christy.
It's my pleasure. Thank you all for having me. If you'll give me just 1 second to get my slides up and running. And if I could get a visual confirmation that you see the slides. Okay, awesome. Thank you so much. All right. So as you have just heard, my name is Christy Kent. I am with Healthy Blue, which is Blue Cross and Blue Shield of North Carolina's Medicaid plan for the state. I'm pleased to be here with you tonight. Thank you so much for spending your time on a Thursday night here with us. I'm excited to be here with NC Child because I'm a North Carolina native. I currently live in Durham, but I grew up in Henderson County, just south of Asheville, North Carolina. And as a child of North Carolina, I really felt like I had a lot of resources, a lot of positive input that allowed me to live a healthy life and live a life where I could pursue the things that I want to pursue. And for my goal for all children here is to have those same opportunities to be healthy, to be engaged in their community, and to feel like they live in a safe environment where they can thrive. So that passion is why I love working with Healthy Blue. Healthy Blue is part of Blue Cross North Carolina, as I mentioned earlier. Blue Cross has been here since 1933. We serve more than 3.8 million North Carolinians and across all 100 counties, and we're really proud that we can be serving Medicaid beneficiaries starting July 1st. So like the other plans I will mention, we are in all 6 regions, and we have dedicated staff in 6 regions as well. So we're going to want to be able to engage with you no matter where you live. And we're also very proud that we have great community partnerships that we've built over the 85 plus years we've been here in North Carolina. So we'll be working with those community partners and have our great local community representatives. They're working in your local community and your local neighborhood to support you and those you may know who use Medicaid as we all make this transition. All right. Everything I say tonight, you're going to be able to find on our website, choosehealthybluenc.com. So I'm not going to read all of the slides verbatim, but just know that if you need to look up this information, this is where you can find it. And we'll also make materials available in Spanish if there's anyone who would like that. We have some handouts and some other information that we can make available easily to NC Child to send out after the event. All right, so here's one thing I really want to emphasize tonight. Being able to support Medicaid beneficiaries means more than just physical health. We all know that as a person, our physical health is important, but also our mental health, and also those factors outside a doctor's office contribute to our health, how our local communities are, how we connect with other people. All of those things matter, and Healthy Blue is set up to support that. So we want you to be able to find your doctor, find your benefits. So we want you to be able to get a ride to your appointment. We also want you to be able to navigate challenges that may affect your life and your health, like food insecurity. We want to make sure you're connected to your community. All of these things give us a healthy life. And so that's where we want to focus for our Healthy Blue members. As I mentioned, drivers of health are really critical, and that's one of the things we'll be focusing on. In addition to the basic benefits that Lindsay did a great job covering a few minutes ago, and all of the plans will have those same Medicaid benefits you've always experienced. Every single one of us will offer that. The state requires us to do so. Well, but all the plans will also be addressing those non-clinical drivers of health, like food and housing, that make all of us healthier. So one of the things that we want to talk about how we do that with Healthy Blue is through those community relationships. It is also through screenings to make sure we know if someone needs extra support. It's participating in healthy opportunity pilots, and it's also providing some of those extra benefits through our value-added services. I'm not going to read all of these to you, but I want to highlight just a few on each page. So when you think about staying healthy, we have some supports around fresh fruits and vegetables and the Weight Watchers classes that I think you'll hear a lot tonight. You're probably going to hear a lot of us say some very similar things. For kids, we want to help them be able to be active in their communities through youth club. We want to be able to get kids active in after school activities. And as far as education concerns, we really want to encourage folks to be engaged academically, whether that's through an incentive for good grades or helping someone get their GED if that is what is of interest to them. For moms, we're going to be able to support breastfeeding, safe sleep, and we're piloting a couple of doula programs we're really excited about. And we also have several housing value-added services to help people either stay in their home to make it safe for them, or perhaps help someone transition if they have experienced homelessness and are looking and trying to get back into stable housing. And we also really want to emphasize that we know that there's just some extra kind of things that can help you day to day, and that might include asthma or allergy relief products. It might include substance use support, recovery support. There are just a lot of things in this category that you can take advantage of if you're eligible as a member. And I do think I've heard Faith mention this before, and I bet she'll mention it again tonight, that you do want to, when you're evaluating this, you do want to make sure as you think through what works best for your family, that those eligibility requirements you meet those eligibility requirements rather. And the enrollment broker would be a great resource for determining that as well. And so here's just a few extra value added services. And last but not least, I wanted to touch briefly on transportation. We are all required to provide non-emergency medical transportation to Medicaid beneficiaries. Healthy Blue has chosen to provide it to Health Choice members as well. And we will use Motive Care to provide that transportation, so that you'll be working with them to make appointments if that's a service that you need to utilize. And this is where I'd like to end it tonight. We're here to work with you, to support you as individuals and as community organizations. We are happy to partner with you to help get the word out, to help educate folks. And we're happy to bring all the plans with us. So all the plans represented here tonight really work so well in cooperation. We will make this easy for folks as we can. But we're happy to come and be in your community, be local, and help really drum up some awareness for Medicaid transformation, because we want people to make a choice. It's so much better to make a choice than have a computer algorithm choose for you, which is how it's going to work. So please don't hesitate to reach out. We can connect you with your local community representative, and you see them out and about in the community in these photos. They'll be happy to come to you and work in your community and provide that education. And so that is it for me tonight. Are there any questions from the group before I hand it over to the next health plan?
I'm not seeing any questions. Do you have any?
There was one question in the chat that David responded to, but I'd just like to ask it just in case other folks want to respond. And that is, if a member has an employer-paid Blue Cross Blue Shield policy as their primary and chooses Healthy Blue as a secondary, are there any pros, cons, or indifferences to that?
So with Medicaid, I think those are two separate things. If one person in the household has Healthy Blue, because they've been determined to be eligible by their local DSS. Their policy with Blue Cross, it wouldn't be for a first policy or a second policy. They're just totally separate. If one member of the household has group coverage and they're a member of a Blue Cross policy, that way their child likely is not going to be eligible for Medicaid as a whole separate policy. I think that's the question being asked, and I am happy to dig into that further if that didn't make sense or if I didn't answer what you need.
And Kaylin, did you have anything that you wanted to add? I'm thinking that the person asking that question probably is eligible for Medicaid based on a special health condition. So they probably are dually insured. So Kaylin, I don't know if you have anything that you want to add to that.
I don't, but and it looks like, I think you're absolutely right, Lamine, that they're probably eligible based on specific criteria. So I don't have anything to add to that, but I'm happy to follow up offline as well. And
so Kaylin or anybody at NC Child, you can feel free to give my contact information to the person if you would like to talk directly, or if they want to just message you privately their information so that you could pass it along to me, happy to follow up on that.
Thank you so much. We really appreciate it, Christy. Thank you. If there are no other questions for Christy, I will pass it on to our next presenter, Faith Samples from Carolina Complete Health. We are really happy to have you join us this evening.
Good evening, everyone. It's a pleasure to be here. I will share my screen and get us moving here. I feel like I have a lot of things on my screen, but I think I only have one thing up. Let's see if it will share. Give me just a moment. I'm not seeing it come up. So it's on my second screen. Bear with me 1 second and see if I can move it over. Give me just a second. Let's see. There are always technology issues, but let me see if I can move it over. I'm working on a dual screen and it doesn't want to show up on the screen I had it on. So let's see if I can get it here and move it to slide. There we go. All right, there we go. All right, can everyone see my screen?
Yeah.
Perfect, thank you. All right, so again, I am Dr. Faith Samples. I am the Director of Community Partnerships and the DSS Liaison for Carolina Complete Health. It is a pleasure to be here with you tonight, and I'm going to try to be brief because there is a lot of information about the plans out there, both on our website as well as on the DHHS website that'll provide you with some information about our plan. But just to give you a little bit of background, Carolina Complete Health is new to North Carolina, but we're not new to healthcare. We are part of a larger corporation that has been around for quite a number of years and is in all 50 states. We are locally branded to connect with the community here, but we are present in the marketplace, in Medicare and in Medicaid. We've been doing this work for a very long time and are looking forward to doing it here in North Carolina. We are unique in two very distinctive ways. One is that we are a group that was developed here in North Carolina, we're developed by a group of physicians who are providers of Medicaid here in the state. We are really hoping that they will guide us through the work that we'll be doing here with the Medicaid population. They know the population well and will be advising us to ensure that we provide quality services to the members of our plan. We are also unique in that, unlike all of the other PHPs, we are regional. So we are operating only in regions 3, 4, and 5. So we have offices here in Charlotte, which is our home base, but we also have offices in Wilmington, which is one of our regions, the region 4, Region 5 is Wilmington, and Region 4 is the Raleigh-Durham area and the surrounding counties. So we will have a presence across the 3 regions to ensure that we're able to provide for all of the beneficiaries who sign up for our plan. As was stated earlier, all of the benefits that you currently receive as a Medicaid recipient will continue to be available to you. Those include a number of the items that are here. This is not an exhaustive list, but simply a summary of some of the benefits that you currently receive and are eligible for and will continue to receive under the new plan, and that is for all of the PHPs. The current services will maintain the current status for all of you. The other thing I want to do is just really go through these briefly. I'm not going to spend too much time on the value-added services. This is not an exhaustive list, but it is some of the value-added services that will be available to you through our plan. Those include a vision benefit, benefits for new mothers and pregnant women. That will be an entire kit of services that will be available to you. We'll also be doing events in the community to include baby showers and other programs and interventions that will provide as part of your membership services. We'll also have benefits for children and adults around education, as well as after school, which should be on my next slide here. There will be a number of opportunities for after school activities that children can engage in, ranging from museums to sports camps to the Y or the Boys and Girls Clubs. You will be able to select what best fits your child's needs and the needs of your family. Again, there will be, and you've heard this with some of the other plans already, there will be a healthy food benefit to support nutrition and health and well-being in your family, as well as cell phone service that will allow you to remain connected to your providers and to have the capability of virtual visits and the like. There will additionally be an over-the-counter benefit that you will be able to access in addition to your basic pharmacy benefit. As others have mentioned, there will be an option for Weight Watchers that's really designed for disease management specifically. So blood pressure, self-monitoring, diabetes prevention. There will also be Weight Watchers for just basic weight management. So the disease management programs will be through the Y, and then Weight Watchers will be available for you for healthy diet and weight loss. And then there will also be benefits to incentivize you to maintain your health on a normal and routine basis by seeing your practitioners for well visits for those, for yourself and for your children as well. And then I'm moving a little fast, I'm sorry. And then there will be additional benefits, transportation, that's a standard benefit that will be provided to you. There will be housing supports. There's language assistance as well. We have bilingual staff, but we'll also have the capacity to engage individuals in a number of languages through our call center. So there are a number of benefits that will be available to you. It's late in the evening and I want to be mindful of our time, but also not go on too long. Just finally, really want to close out with our mission. Our goal really is to transform the community one person at a time. We are looking to really not only provide integrated health, but whole health care that addresses all of you, all of your children, all of your family at the most fundamental level, which is individually what your needs are, how do we assess those needs and provide for those needs, how do we fill gaps in the community, whether they're medical or non-medical drivers of your health, how do we address those in ways that make you whole? That is our goal and our mission. And I'll simply end with our customer service number. We have a website as well with more detail, as I've indicated, and that is available to you at mycarolinacompletehealth.com. Thank you so much for your time. I appreciate it.
Thank you so much. Do we have any questions? Anything that's come up? Not seeing any in the chat box. So please remember to feel free to ask whatever questions you have. And we really appreciate, thank you so much, Dr. Samples. It's great to have you with us. All right. I feel like a game show host now. Come on down. So next we have from United Healthcare of North Carolina, Paige Hales. Thank you so much for joining us this evening, Paige.
Yeah, no problem. It's great to be here. So, Alex, I'll take economics for 100 on the game show.
You're gonna win. You're not gonna do well with that category.
I don't even know why I chose economics because I don't know anything about it. So anyway, so let's get started. I thought we'd put a little, inject a little bit of fun into this webinar tonight. My name is Paige Hales, and I am the Community Collaboration Advocate for United Healthcare. I live in Wilmington, and I grew up about 30 miles from here up in Jacksonville, North Carolina. So I am a North Carolina native, and I would like to say thanks for NC Child for putting this together. This is great. And one of the great things about it is that we have a lot of attendees here tonight that are listening in. So, good outcomes for this because we have people that are listening and they want to know what's going on, with Medicaid transformation in North Carolina. And I really, really like it that we have some attention being paid to what we're doing here. So let me just tell you a little bit about who is United Healthcare. So United Healthcare has been in North Carolina for 27 years. So we are a mission-driven organization grounded in values of compassion, integrity, innovation, performance, and relationships. Our mission is helping people live healthier lives and helping make the health system work better for everyone. So I have a presentation. Let me see if I can find it. Okay, so I'm gonna click on it. So, can you see my screen? Yeah? Okay.
Yeah.
Okay, great. So let me make it a little bit bigger. Okay, so Faith and Christy and I think it was it Jan with AmeriHealth did a really good job explaining, what is happening here in North Carolina and the context and the history of what has happened with Medicaid transformation and how we're moving forward with it. As with all of the other plans, we have the basic cover services, but we also do have our value adds, of which I'm going to go over in just a second. But I do want to show you my team. So this is my team, and we are doing community outreach throughout North Carolina. So there are 7 of us. So we have Kara, we have Delana, we have Sharon, Jennifer, me down on the bottom left with New Hampshire for Kids, and Jamie. So that's our team, and we're out doing community outreach. We're talking to community-based organizations, faith-based organizations, and most importantly, we're talking to the members and helping them navigate their way through Medicaid transformation in North Carolina. And we know how complex it is. So what I've decided to do is I've linked a video for you guys to watch. And this is about 2 minutes long, and hopefully we can hear it. And it's going to talk about who United Healthcare is and what our value-added benefits are. So cross your fingers, guys. Let's hope it works.
I am not sure we are getting in this video.
Yeah, it doesn't appear to be playing, Paige.
Paige, on Zoom, I think you have to, when you share your screen, if you switch from like PowerPoint to Chrome or whatever your browser is, I think you have to share that program.
So tell me what I should do. So can you see the video or not?
No, we just
No.
still see your PowerPoint screen.
Oh, okay. So do I have to do a new share then? Maybe?
Yes, you'll want to open the video in a separate browser window. You'll want to stop sharing, share again, and make sure that you click to share computer audio as well.
Okay. So can you see it now?
Yes.
Okay. So let me get back here. Can you hear it?
No.
Okay.
I think
Well,
share screen, you can choose to share your computer's audio as well.
There'll be a little, if you stop your share, there'll be a little checkbox at the bottom when you click the share your screen button, where you'll be able to click share computer audio, and that should do it.
okay. So I'm sorry, I don't want to take up everybody's time. So there's a place that says stop video and
Yes.
okay. And then it has video settings. Is that what I need to click?
No.
No? Okay.
Where it says share screen, the green arrow, you'll want to click stop share. At the bottom of your screen.
Okay, I hit it.
Great. Now you want to click share screen.
Okay.
You'll want to click the checkbox that says share computer audio. It should be toward the bottom.
Oh, share computer sound?
Yes.
Okay. I think we're almost there. Okay. So
Yeah. And then click on the screen you want to share and you should be all set.
okay. So
and extras that can make a real difference in your life.
okay. Now? Yay!
It's your health. It's your choice.
Okay.
Everyone deserves affordable health care, including you. That includes working adults, people with disabilities, pregnant women, and children. If that's you, check out United Healthcare Community Plan Medicaid. We have the Medicaid services and extras that can make a real difference in your life, all at no cost to you. Find a doctor you trust in our network. Unlimited doctor visits for adults, vision coverage, transportation to and from doctor's appointments, 24/7 nurse line to answer your health questions. Sometimes you might need a little extra help. Get extras not covered by Medicaid. Earn rewards for keeping you and your baby healthy. Earn gift cards for getting preventative services. Support in treatment to reach a healthy weight. Members 18 and older can get free GED exam voucher and materials, up to $160. We also offer resources to help you make the most of your plan, including member advocates, social services support, nutrition coaching, health education tools, care management. Visit ncmedicaidplans.gov for more information. Helping you live a healthier life. We are here for you, North Carolina. Remember to choose United Healthcare Community Plan and get the plan that gets you more. To learn more about United Healthcare Community Plan, visit uhccommunityplan.com/NC.
All right. So I think the most important thing here is that is our website there, uhccommunityplan.com/North Carolina. And that video went over our value adds. And thank you very much for helping me with the technical aspect of getting this video to work, because that was actually the first time I've ever tried to do a video on Zoom before. So thank you so much for your patience. And does anybody have any questions?
So we did have one question, which is, what are the steps that folks need to take advantage of these incentive programs that people have been talking about? So I can open that up to you or any of the other panelists, but that did come through.
Yeah, so that's probably one of the most important questions is, how do I start? So you should have gotten a notification letter in the mail, and if not, you can go to ncmedicaidplans.gov. That is definitely where you need to go, and that's where you can find your information. And once you get there, you'll have an option to either sign up online, or you can call the number that's on the page there, and they're open Monday through Friday from, I think, 8 a.m. until 6 in the afternoon on Saturday. Monday through Saturday. I do believe they're closed on Sunday. So the first thing to do
We're 7
is,
days a week right now.
oh, are you? So yeah,
Yeah,
that's
oh.
information for the, Carter would probably be a good person to answer this question if you want to go ahead and elaborate.
Yes, I'm with the enrollment broker, and so we're open 24 hours, 7 to 8. Oh dear.
You're getting a background echo that's making it a little bit hard for you to hear, Carter, for us to hear you.
Sorry about that. Can y'all hear me?
Yeah.
Okay. The enrollment broker is open 7 to 8, 7 days a week, and I'll go into information when I present for the enrollment broker. Thank you.
Perfect. Thank you so much. Are there any other questions? I'm not seeing anything open. So with that, we'll move right along. Thank you so much, Paige. And thanks everyone as we go through our technology journey this evening. Those are just the signs of the times, right? So without further ado, it is my pleasure to introduce Jessica Beach, who is with WellCare of North Carolina. Jessica, thank you so much for joining us this evening.
Thank you for having me on this webinar this evening, and thanks to everyone who's joining on a Thursday evening. I so appreciate you taking the time to learn a little bit more about Medicaid transformation and what it means. I'm going to share my screen, share a little presentation. Thankfully, all of the other PHPs have gone ahead of me, so I can skip a lot of the fun details at the beginning. So I'll try and be respectful of all of our time and get through this as quickly as I can. Okay. Hold on one second. Here we go. All right, can everybody see my screen?
Yes.
All right, perfect. Thank you. Okay. So like I said earlier, my name is Jessica Beach, and I am the Tribal Programs Manager with WellCare of North Carolina. I also work across Region 1, doing outreach and engagement efforts. So I do a little bit of everything with our health plan, and I get to work all across the state, which is wonderful. I'm also a 0 to 3 fellow in the cycle, so I get to do a lot of really fun work in the space of early childhood and with families who have young children. So just a little bit about who WellCare of North Carolina is, our mission and values. We're really focused on our members. We're very member-centered. And so our whole reason for being a health plan is to really be responsive to our members and their needs. Helping them to live better and healthier lives. WellCare of North Carolina, or WellCare, has always worked in the space of government-funded healthcare. So this has been something we've always been focused on. We've only ever really done Medicare and Medicaid. So this is something that we're really familiar with, and we're excited to be able to be a part of the team bringing managed care to North Carolina. So WellCare's approach, we're really committed to having a local presence. I'll talk a little bit about this later in the presentation, but we have folks that are physically located in all of the regions across the state. We believe that we really need to have that community presence so that we can be there to build those relationships with our members, with providers, so that we can provide those wraparound services for our members and so that they have a really great experience as a WellCare member. We also, again, believe that this work is really integrated, and healthcare is more than just going to your doctor and getting a particular service. There are so many things that touch and make a member's healthcare experience what it is. So we like to kind of show this graphic to show all of the ways that our members are touched by the healthcare system, and that it's much more than just going to go and seeing your primary care provider. So I'm going to skip over all of these slides and move on down to our community focus with WellCare of North Carolina. So as I mentioned, we'll have a physical presence in all 6 regions. We have what are called welcome rooms, and that's our like brick and mortar location for our health plan in each of the regions. We also do what's called pop-up regional welcome rooms. So like if you look at Region 1, our welcome room is located in Buncombe County in Asheville. And just knowing the terrain of Region 1, we know that it'll be challenging for some of our members to come into our local welcome room. So we partner with organizations like the YMCA, school districts, other community partners that have a large facility, and we'll go and set up a welcome room co-hosting with them over a week, and bring some of the cool things that we do in our welcome room to the more outerlying parts of each region. So in our actual welcome rooms, the brick and mortar locations, we do things like baby showers, nutrition education. Community partners can utilize our space for meetings. So we really want it to be a place where our members can come and just learn more about their healthcare benefits, and then also just take part in activities that are of interest to them. So I think that's all I need to share about that. I'm also going to talk a little bit about our value-added benefits. I apologize if it's duplicative or we've gone over this a little bit, but I'll try and keep to the ones that are unique to WellCare. For value-added benefits that touch youth programs and education, we cover 4-H and Girl Scouts and Boy Scouts. We also cover an annual sports physical for young children. We cover tutoring, and then we want to support our members who are working to obtain their GED. So we also provide support with that as well. For families with young children, we offer baby showers, breast pumps. We have a stroller and a pack and play program. We also offer NEMT for Health Choice members. Something that I think is a really great offering is that we offer caregiver vaccinations. So if a grandparent or an aunt or uncle is a caregiver for a child and they don't have health insurance, we cover flu vaccines and whooping cough vaccines for that caregiver. We also have a cell phone program. We offer some over-the-counter items each month. We also offer a Curves membership for our members. And then we have some that are more diagnosis specific. So for members who have maybe asthma, we offer the peak flow meter, hypoallergenic bedding, carpet cleaning. We also have a diabetes camp for kids who are at risk for diabetes. So those are some of the ones that are more specific. I think I saw a question earlier that was around how do you access these benefits? So for WellCare, that is through our call center. So when a member or beneficiary selects WellCare, you'll get a packet in the mail. That's really a welcome kit, has your WellCare ID card, that has a phone number on there that you can call our call center. Our call center is open now, so if you have any questions about very specific value-added benefits, and if there are additional requirements for those, the enrollment broker can help you kind of walk through that and figure out any additional criteria that may be required. But once a beneficiary is selected WellCare, our call center folks can help walk through how you access each of these benefits and if there's any additional information that's needed for a member to access any of these. And that is all that I have. So I'm going to stop sharing. Are there any questions?
Thank you so much, Jessica. I am not seeing any. It does not look like we have any right now. But as another reminder, please feel free. You can feel free too if you want. I feel 3 right now on Thursday evening. That's a big vibe. Please put them in the question and answer box, or you can put them in the chat box. We're looking at both. And And so thank you so much, Jessica. Thank you to everyone coming from our plans. We really appreciate you giving your overviews and what you're offering to beneficiaries that might enroll in your plan. And so now to talk a little bit more about the nuts and bolts of enrolling, we have with us Carter Wade from the Enrollment Broker's office. So we are really happy to have you join us, Carter. We started to hear from you just a bit ago, so we're really looking forward to continuing on to understand a little bit more about how folks can enroll and choose plans that work for them and what the services of the Enrollment Broker are.
My pleasure. Thank you so much. Can y'all hear me okay?
Yeah, we hear you loud and clear.
Awesome. Okay, and I want to confirm that you all see the Enrollment Broker NC Child slide only?
Yes.
Okay, great. So just one moment. Let's see, I was trying to hide myself. Okay. Good evening. Yes, thank you so much for making this possible. NC Child, very exciting. I'm Carter Wade with the Outreach and Enrollment Broker. I'm the Outreach and Education Manager for the North Carolina Enrollment Broker. Quick disclaimer, the Enrollment Broker kindly asks that attendees of this presentation do not record this session and or post this presentation without written permission from the North Carolina Department of Health and Human Services, NC DHHS. An audio recorded presentation of this presentation, and it's 30 minutes long, is on the NC Medicaid Managed Care website, ncmedicaidplans.gov, located under Member Resources. So Medicaid Transformation, you've heard a lot about it tonight, and I'll give a little more information. Medicaid Transformation is changing the way most people receive Medicaid services, and this will be through North Carolina Medicaid Managed Care. The North Carolina Department of Health and Human Services, also referred to as NC DHHS, will transition Medicaid and North Carolina Health Choice from fee-for-service to managed care. Under North Carolina Medicaid Managed Care, the state is contracting with prepaid health plans, PHPs, that will assume all the risks for the members they cover. PHPs will be paid a predetermined set rate per person to provide health care services. Beneficiaries will be able to choose their health plan. Now, what is EBCI Tribal Option? The state is contracting with the Cherokee Indian Hospital Authority, CHIA, to support the Eastern Band of Cherokee Indians, EBCI, in addressing the health needs of American Indian Alaska Native Medicaid beneficiaries. This new delivery system, the EBCI Tribal Option, will manage the health care for tribal Medicaid beneficiaries primarily in Cherokee, Graham, Haywood, Jackson, and Swain counties. Who is impacted? Approximately 4,000 tribal Medicaid beneficiaries will transition to NC Medicaid Managed Care. Now, timeline. Eligible beneficiaries will have received enrollment packets from the enrollment broker prior to the open enrollment period. Open enrollment began March 15th, 2021, and will end May 14th, 2021. Midway through the open enrollment, a reminder postcard will be sent out. All beneficiaries must enroll by the end of the open enrollment period. If they've not completed enrollment by the end of the open enrollment period, a health plan will be chosen for them. On the timeline, you'll see this noted as auto enrollment. A primary 90-day choice window, which ends September 30th, 2021. Now, who is the enrollment broker I've been talking about that I'm with? Well, the enrollment broker is an unbiased third-party entity partnering with NC DHHS to help beneficiaries transition from NC Medicaid Direct to NC Medicaid Managed Care. We're truly independent, and our goal is to help beneficiaries select the right health plan and primary care provider, PCP, based on their health needs and other factors that are important to them. An unbiased enrollment broker can ensure program integrity while helping beneficiaries select the best health coverage for them and their family. Now, as a reminder, the enrollment broker mails out the enrollment packets to the beneficiaries. In the enrollment packet, the beneficiary will receive a notice that describes what NC Managed Care and NC Medicaid Direct are, what they need to do next, and how to complete the next steps. They'll also receive a health plan choice guide with all the health plans, the additional services they're offering, Broker is to meet the beneficiary where they are. The enrollment broker offers a multi-channel solution for North Carolinians. New self-service options and user-friendly avenues for obtaining program information, choosing a health plan, completing enrollment, and receiving assistance are all designed with the beneficiary in mind. The enrollment broker can provide choice counseling and enrollment completion services through a variety of different channels. We'll review a few of the primary channels in the following slides, including ncmedicaidplans.gov website, web chat, the NC Medicaid Managed Care mobile app, and the enrollment broker call center. These are the channels that beneficiaries can use to enroll in NC Medicaid Managed Care, in addition to mailing, faxing in their enrollment form. ncmedicaidplans.gov website is designed to enhance online access to program services and provide a seamless enrollment experience. The website is compatible with Internet Explorer, Microsoft Edge, Firefox, Chrome, and Safari. The website also includes features to adjust font size and change to Spanish and English as desired. The web chat feature on the enrollment specialist through a secure web portal. The enrollment specialist staffing the web chat will respond within 20 seconds. Incoming chats in the 20 seconds, excuse me. The North Carolina Medicaid Managed Care mobile app is available for iOS and Android devices. It's available for iOS version 10.0 or higher and Android version 7.0 or higher. The app can be used in English or Spanish as set by user preference. Beneficiaries can enroll, so you can use the app to choose a PCP, health plan, and enroll. Now, this graphic highlights key features of the NC Medicaid Managed Care mobile app. Like the website, users can use the app to view health plans, search for PCPs, complete enrollment, and make changes to their health plan and provider choices. The NC Medicaid Managed Care mobile app will perform a real-time lookup with NC Fast to pull most current beneficiary data before their case information is displayed on the screen. Now, after authenticating as head of household, the user will be able to view enrollment information about each person tied to the case. After authenticating as non-head of household, the user will be able to view enrollment information about their case. Now, hours of operation. Enrollment specialists can be reached by phone by calling 1-833-870-5500. For assistance via text telephone, beneficiaries can call the TTY number at 1-833-870-5588, and the call is toll free. Now, and the extended hours for our call center is 7 a.m. to 8 p.m., 7 days a week. Outside of open enrollment, the enrollment specialists are available Monday through Saturday at 7 a.m. to 5 p.m. Now, the enrollment broker has an outreach team dedicated to community and beneficiary engagement, as well as tribal community outreach. The enrollment broker will provide two types of events: an outreach partner engagement to educate and engage partners, and community outreach to engage beneficiaries. And these events will be held virtually or in person following CDC guidelines. Now, this is our outreach materials, and what you see here are the ones intended to help inform beneficiaries about North Carolina Medicaid Managed Care. Now, the materials shown here are available on ncmedicaidplans.gov website under Member Resources. They include a poster, a fact sheet, tribal handout, palm card, and flyer, and you can also locate the video that we have. And when people change the language from English to Spanish, they'll be able to get these same materials in Spanish or in English. And throughout the transition, the enrollment broker will share information with beneficiaries at a local level through a variety of community events. Mail, and fax. Now, as a eligibility. For all questions related to choice counseling or enrollment, beneficiaries should reach out to and change in PCP. Now you've heard from the plans today and great information. This slide actually breaks down the different ones, their websites, their phone number and TTY number. And again, the plans are EBCI Tribal Option, WellCare, United Healthcare, Healthy Blue, AmeriHealth Caritas, and Carolina Complete Health. And that concludes
specialists that do take Medicaid but will not be participating in managed care or aren't contracting with the plan that they are on, can they continue to see these providers for continuity of care even though they are not in network? This is coming especially with rare diseases, as there aren't that many choices of doctors.
Gotcha. I'll take that one back for a moment. Give me a few minutes, because I would wonder if this person has gotten the letters saying that they have to enroll, but if they feel that their child or this patient, that they shouldn't have to enroll due to different situations regarding behavioral health and different things, perhaps they can get the redetermination. So give me a few moments on that and I'll clarify.
No problem. Thank you so much. Yes.
Caitlin, this is Julianne Taylor with the North Carolina Medicaid Ombudsman, and I just wanted to chime in on that, if that's okay.
Yes.
So, in addition to what Carter said, I would also say that individual, when they contact the enrollment broker, they would know, they may be able to check the status, whether they're mandatory or exempt. And if they're listed in the system as mandatory, but they have those additional needs, they can still complete one of the stay in Medicaid direct forms that's available online. And then also one of those forms that is available to providers, and their providers may be able to assist them to complete that.
So thank you. This attendee just flagged in the chat that they are not exempt. They do have to enroll, so they don't qualify for the exception.
Okay, we'll get some information back to them and some links that can be shared. Thank you, Julianne.
Awesome. Well, thank you both. Right now, I'm not seeing any additional questions. So we already got a sneak preview of our next speaker from the Ombudsman program, which went live today. We have Julianne Taylor. Thank you so much for joining us, and we're so happy to have you with us this evening.
Thanks, Caitlin. I appreciate it. And thank you, NC Child, for having us. And it's great to see all of my fellow colleagues with the PHPs and the enrollment broker again. So I'm going to share my screen as well. I think I'm going to share my screen. There we go. I'm going to share my screen. So I hope that you all can see that. So I am with the North Carolina Medicaid Ombudsman. Our contract was awarded in January, so we are a little bit late to the game, as the PHPs and the enrollment broker knows, but they have all been very open and welcome to inviting the Ombudsman to their events and all of their outreach activities that they are doing. And we and all of us sort of work together to make sure that North Carolina families with Medicaid have access to that, that care that they need, and that continuity of care continues. So our four core responsibilities at the Ombudsman are to provide free confidential support and education about the rights and responsibilities people have under North Carolina Medicaid. So with this new transition, you know, while there were a lot of rights and responsibilities that existed before, on those rights and responsibilities and really empowering them to take charge when it comes to their health care. We'll also connect people to resources like legal aid, social services, housing resources, food assistance, and other programs. And we're here to educate, advocate, refer and connect, and communicate with DHHS and partners. So, said, we launched today, so it's been kind of a crazy day for us, but it's also been wonderful. This is our phone number where you can reach us. Our email and in-person are coming soon, and then you can visit our website at ncmedicaidombudsman.org where you can find some helpful information. So the services that we are going to be providing is like I said, we really want to provide Medicaid beneficiaries with information about their rights under managed care and Medicaid Direct. So we want them to know that, you know, if they've been denied a service that they shouldn't have been, or if they're supposed to be, you know, if maybe they really need to be or remain Medicaid Direct and a PHP maybe isn't the best option for them, or if they're in Direct and they're confused about the process to get to the PHP, we're happy to do that. So we really want them to know, you know, what that information is. So providing that information and education to individuals is really a big role of the Ombudsman. And then we also want to offer members guidance on filing appeals or grievances with their health plans if that's necessary. So, you know, if they've been receiving a service for a period of time and then for whatever reason it's denied, you know, we want to help them, you know what that there is an appeal and grievance process and that we can assist them with that process. We also want to assist with investigating issues reported by members and help them try to resolve the issues informally. So, you know, rather than going directly to, you know, some sort of, you know, legal case or something like that, we want to make sure that they are exhausting all of the avenues that they can before it actually gets to that point, so that we can go ahead and get the issue resolved quickly for them. And again, they can get access to that care that they so need. And then also we are going to be a trend monitor. So we're going to be monitoring issues that members experience with the health plans and communicate those with DHHS to address those problems. So, you know, if we have like a number of callers that are calling from a specific health plan and they're having issues getting through, or there's some information that they're receiving that, you know, isn't consistent with, you know, what we've seen or what we have, you know, we'll be communicating that information with DHHS so that they can get that information and that they can, you know, communicate that so they can get that addressed. And we also, you know, having that direct line of communication allows these issues to get resolved much more quickly. And so it isn't something that a lot of callers are seeing. You know, if we see a bundle of consumers that's happening to or beneficiaries in one single day, and we're able to get that addressed and fixed for the following day, that's a huge win for everyone. And then also referring members to community service organizations for to support health related needs, including legal aid, social services, and other support. So if someone ends up calling us and they end up not really having a managed care issue, or they have one simple managed care issue, but maybe they mentioned that they're also food insecure, or they're having landlord tenant issues, we want to be able to refer them to the resources that are available in their area. We plan on utilizing the NC Care 360 platform as well as 211 to make sure that across the state, we're providing resources that are available to them for those specific needs. And then this is sort of the last spiel, is that the Ombudsman really, you know, the approach that we're going for is this no wrong door. So in individuals contacting us, even if they don't have a managed care issue, we still want to be able to connect them with the resources that they need. Why did you call today? What were you looking for? We want to be there for them. We have worked with, Medicaid beneficiaries for years, not the Ombudsman, but the legal aid entities. We understand that with Medicaid beneficiaries, there's not a lot of time on their side, right? Like they don't have a lot of time to contact a lot of different places trying to find resources and figure out what's going on. They may have, they may be taking time away from their job, and they may be an hourly wage worker and they're using minutes on their cell phone. And so we don't want anyone to waste any time contacting the Ombudsman. We want to be a constant resource for North Carolina families, whether or not it's a managed care issue. So while obviously our primary focus is managed care and assisting those beneficiaries and members with issues that they're having. But if someone contacts us and they have questions about something else, some other resource that they need, we definitely want to be available to be able to assist them to do that. And a part of that, obviously, as I stated before, is food stamps, and then also disability, supplemental security income, veterans benefits, private health insurance, and also their eligibility for Medicaid. So obviously, while we can't determine their eligibility because that's DSS's job, we can let them know, hey, based on the information you've told me, it really sounds like you should be eligible for Medicaid. So you should contact your DSS office and maybe reapply. Window, you should appeal that and then contact this particular legal aid office in your area to be able to see if they can take your case and help you, to kind of go through that process. So that's the Ombudsman, and we're excited to be a part of this transition to managed care that North Carolina is undergoing. And again, we really appreciate the partnerships with the PHPs, the enrollment broker, and organizations like NC Child. We wouldn't be able to get all this information out without partners like you. So thank you so much. Oh, sorry, last slide. And I would be remiss not to include this. Service is not offered by the Ombudsman. So the Ombudsman itself is not offering legal services. I want to make that clear. So while we can assist individuals with gathering forms, finding forms, filing appeals, initial appeals, and gathering the information that they need in order to do that, the Ombudsman is not, we are not doing any sort of legal representation. However, if someone does contact us and they do need a legal representative, we can refer them. We have formal referral agreements with Legal Aid, Pisgah Legal Services, and Charlotte Center for Legal Advocacy to be able to refer them to an attorney that can assist them with that appeal process. And that is all.
Thank you so much, Julianne. That is so helpful. We're so happy to have you. I have a couple of questions. One, I know that there's not been a ton of communication sent out by DHHS. It looks like there will be reminder cards going out shortly, but wondering if there will be any additional information sent to beneficiaries about the Ombudsman program and how to utilize these services.
So that is a great question. And that it has definitely been a challenge considering we were granted the contract in January. So a lot of materials had already been finalized or gone to the printer. So the Ombudsman information is not included in a lot of places right now, but we are working with DHHS to do that. The PHPs, their member handbooks actually have all been updated for the most part. I won't call out the one that hasn't. But for the most part, those have all been updated. So that information is included in there, which is incredibly helpful. And we are really just trying to push our website. That's really been a big source of really the only thing that we can push as much as we can. So we really rely on our partners to help us get that word out. We haven't had any guarantee from the state that our information will be included on the welcome packets. But I know that right now the enrollment broker is working on getting our information on their Get Answers page, which I think is really great and really helpful and has been a really great resource for our staff as well as for callers that have contacted us. So we really like that resource. That's been really great. And so I guess the answer to that is really stay tuned. But we are pushing very hard. And if anybody knows my supervisor, Doug C., he is very persistent. So he is working very hard to make sure that our ombudsman contact information is in as many places as possible. But right now it is a little bit on the sparse side. But we're working on it.
Thank you so much. Another question is, can the Ombudsman program assist people in Medicaid Direct or non-managed care program? Specifically asking about people eligible, for refugee medical assistance and programs for single adult refugees and couples without children.
So that's an interesting question. I would say, for someone who really needs assistance with Medicaid Direct or non-managed care programs, they can always contact the Ombudsman. What we'll probably do is not be able to really answer a lot of those direct questions, but definitely be able to refer them to where they need to go. I would say the first is DSS, but I understand that there are language access issues at DSSs, not on a regular basis, but kind of. And so what I would suggest is that they actually contact a navigator, and they can do that through the North Carolina Navigator Consortium. So they can assist them with even filling out an application for Medicaid, as well as getting information about eligibility for programs like the Refugee Medicaid program. And so that statewide phone number is 1-855-733-3711. And I know that only because right before January, for 7 years, I was the navigator supervisor at our organization. So that's a great number to call for individuals who need information about their eligibility for Medicaid and need assistance to apply for those programs. That's a great resource, especially if your DSS office is overwhelmed, which is often, especially here in Mecklenburg County and Charlotte.
Thank you so much. And we will can you actually repeat that phone number so we can throw that?
I'll put it in the chat.
Okay, thank you. I was very impressed that you remembered a phone number. I can't remember the last one I remembered. So we have one more question about folks in foster care who do not have to enroll in managed care quite yet. But I will go ahead and read the question. It says, our daughter was previously in foster care. Okay, so excuse me, former foster care. We are now her guardians as of December 2020, but she will be 18 in September. Can you speak to her situation since she will be an adult in less than a year after this change? So I think it's more about what plan to that they could possibly enroll in and how that might work.
So I am reluctant to give you an exact answer on that. I feel like there's a little bit more information that I would need on that. However, what I will say is that there is a foster care plan specifically for managed care that will be available in 2023. And additionally, with the foster care, so I would say based on that information that she will likely be able to stay in Medicaid Direct through the age of 21, or at least through when those foster care specific plans through Medicaid managed care become available in 2023. So that's what I would say, but I would also suggest that maybe you reach out to a colleague of mine, and she may be able to better answer that question. So I'm happy to privately give you that information so that you can ask her those questions if you'd like.
Thank you so much. We will make sure that y'all get connected. And because we are bumping right up onto our end time, I just want to take one more opportunity to thank everyone who joined us this evening, all of our panelists, all of our plan members, open enrollment. You're still in charge of that, enrollment broker, and of course, the Ombudsman program. We are so happy that you were able to join us. Thank you for walking us through all things Medicaid Transformation. I know that there are some unanswered questions. We will make sure to connect folks to the appropriate people on the back end. You can always email me. I am at Kaylan, Kaylan, at ncchild.org. If you have any follow-up questions, we will make sure to do our due diligence in getting those answered for you. Again, thank you so much to everyone for joining us tonight. We really appreciate it. And we look forward to having more discussions about transformation and making sure that everybody has access to the care that they need and are entitled to. So thanks so much, and we will talk to y'all soon.
Thanks for having us.
Thank you, Kaylan.
Thank you.